Myself, Dr. Ruchi Jain. I am from Nagpur, practicing predictive homeopathy since 2010, and I have been conducting regular sadhana series lectures since 2020. And my purpose here is to spread the right homeopathy, the right knowledge, which has been shared by us through the masters, our stalwarts, their teachings, to be simplified and practical implication of whatever knowledge the stalwarts have shared with us. So let's begin our journey and start with the discussion of a topic which we have decided, and I hope you all have gone through the topic since we have last discussion. So this is the sadhana series lectures which we have started and way back, and we have been continuing doing this, and this is a process to learn, and through the teachings of our masters, let us understand one more new, a very interesting topic of varicose veins. And this topic will give you a complete understanding in a package of how varicose veins develop and how do they progress and what are the conflicts behind the development of varicose veins, and also how to approach through repertory and materia medica with differentiation. So this is a complete package of varicose veins. So nothing goes without the blessings from our masters. Definitely Dr. Samuel Hahnemann sir, who has brought homeopathy to this world, and through the guidance and under the light and knowledge of Dr. Prafull Vijayakar sir, who has always been there as a guiding torchbearer of homeopathy in our lives. So we are also spreading the same light what he has sparkled within us. So friends, let's begin to our topic. As we all know, nothing goes untouched without the tool, that is organon of medicine. So when we talk about any chronic disease, people say the acute disease is not the cup of tea of homeopathy, and cases to come to our desk when we have already exhausted. When the case has really exhausted, the patient has lost the hope that he will ever discover any health in himself and he will be in a cured stage. So this is where homeopathy gives the light through right application of whatever knowledge has been given to us through organon of medicine. So as we all know, when you talk about acute diseases, the tool which we need to address or the tool which we need to use is very different. But when we talk about chronic disease, as Hahnemann sir has rightly mentioned in aphorism number 74, that chronic disease are nothing but because of the prolonged stress, anxiety, or whatever the maintaining cause of the disease or the destructive attacks which are there continuously hitting, and the acute inflammation which was supposed to get settled through the neutrophils, that inflammation goes prolonged and neutrophils lose the battle, and then the battle is being taken up by the lymphocytes or the T lymphocytes or the B lymphocytes. That is the shift of the gear from acute to chronic. And when we call upon discussing varicose veins, definitely it is not an acute disease. Yes, it comes up to us with lot of complications. So we need to understand how body reacts to these destructive and inimical forces which bring upon a revolution in the organism. That means whatever changes are being brought about, they are because of that ongoing thought process, ongoing causative element which doesn't stop by its own. These chronic diseases, if they are not being controlled by a proper homeopathic remedy, these chronic diseases will definitely bring and cripple the disease in such a way that the disease process never stops, and it can even endanger the life of the person. So with the normal purpose, the basic need of survival is being compensated by complete destruction of that organic alterations, or they cripple the body externally or internally completely. Abhi isko we will try to understand this aphorism more in depth. Why Hahnemann sir would say that there were only 3 defenses which are there in the body. So when you will read chronic inflammation, you will understand the disease starts with the acute inflammation itself. Therefore, we say that Sora is mother of all chronic diseases because nothing goes and progresses without any inflammation. So any itis, any inflammation in the body, when it is not able to overcome the disease in few days, then the gear is being transferred. Example we will take. First, the neutrophils come into play. They are very short-living and they are not that powerful to kill the bacteria or the organism or to fight against those powers who are really very dynamic and very forceful and strong. So what happens is that these neutrophils who are very incapable, they give their command now that lymphocytes enter. The eosinophils enter and therefore the neutrophils take away a step back and lymphocytes come into play. It can be, if it is an autoimmune disease, then we see T lymphocytes, they come into play. They are very different. B lymphocytes are very different. So these lymphocytes, when they become macrophages, they have the capacity to bring down the inflammation to a great extent. And they can continue this chronic inflammatory process days and years long. So this is what talked about how neutrophils take a setback and lymphocytes come into play. So this is where the chronic inflammation sets in. So first, there is irritability and sensitivity. That is the primary defense of the body, what we call as SORA. And when this primary defense is unable to overcome, if the enemy is very strong and if the inimical force is very strong, then the body tries to adapt, and that is nothing but the psychotic defense. And during this adaptation, there will be dilatation or contraction, relaxation or induration, which will lead to chronic inflammation over that part or the area of the body. But everything is for the process of at least prevent the cellular destruction to an irreversible phase. And this cellular destruction is kept under control. And this is true where the chronic inflammation goes on and on. But still, if this chronic inflammation is not checked with the right remedy, what will happen? The body says, yeah, I don't want to compromise my complete health. I don't want to compromise that I should cripple my body internally and externally to these inimical forces. So better I should stop this process. And this process should be stopped by at least I can compromise some part, some organ or some tissue rather than the whole body. And this process of destruction goes internally and externally. And this is nothing but when it is called as syphilis. So as we all know, SORA is nothing but a physiological defense where nutrition, respiration, and they are the basic defense of the body which is required for the survival. The need of survival of existence is the basic need of SORA. Then as the body shifts its gear to organization, that is generation, constructive defense, mitosis, a process where the body goes into that defense mechanism that I need to grow, I need to defend, I need to contract, or I need to grow into number so that I can prevent my body from getting crippled. But when this psychotic defense shifts its gear from psychosis to syphilis, then this same immunity which was trying to prevent our body goes against the body defense and nothing is being saved and total destruction comes up. As we all know, it's a cycle from SORA, psychosis to syphilis. Everything, even destruction, is a new beginning. So this is the whole cycle which begins. And homeopathic medicines are capable enough to stop this syphilis when given at the right time, in a right potency and in a right manner. So we as homeopath should be very confident enough that we are able to shift this gear from syphilis and move back the life from destruction to construction and definitely to life and living of happiness and joy. So this is only possible with our remedies. So let us understand our topic today. As Hahnemann sir has said about, there are three defense mechanisms, that is psora, psychosis, and syphilis, and there is no other miasm. Similarly, what Dr. Prafull Vijayakar sir has said, whenever a tissue is being brought under stress, that is in aphorism 72, we have already discussed. So first primarily, when the defense sets in, that is psora, there we see inflammation, irritation, and there are spasms and colics. There is increased sensitivity at the cellular level. But when this defense shifts from psora to psychosis to syphilis, so in psychosis, we see that there are types of psychosis where he has classified psychosis into accumulation, synthesis, deposition, and proliferation. If we want to learn which disease we are trying to treat, please try to classify these diseases into accumulation, synthesis, deposition, proliferation, because every part will have its own defense mechanism. Every type will have its own way of dealing with the diseases. So when you talk about accumulation, so there will be a simple example of accumulation is obesity, is diabetes, where lot of sugar is getting accumulated in the body. Lot of calcium, when gets start depositing, it becomes a renal stone and a gallstone. And when it comes to the level of synthesis, that is fibrin and elastin, then the classification of diseases are very important. Fibrin is something, a material in the body which give structure, which helps binding the structure. And elastin is something like collagen fibers, which elastin fibers, which help to stretch the body. The skin, as we can see, this skin has got its own elasticity. When you lose this elasticity, there is then elastin less pathology which starts. You get hernias, you get prolapses, because it is just like your simple socks which you wear. So there are fibers which keep it compact, and there are few fibers which are the fibers of those elastic bands which help in gripping that socks into your foot. So when that socks loses its grip, what happens? It just falls down and loses the grips. And you say that elastin has become loosened. So we come to know that there are so many pathologies which develop because of this imbalance between elastin and fibrin. And when this imbalance of elastin and fibrin occurs, if you have more, then you will have diseases like fibroids, constipation, because fibrin is something which is like a compact material which helps to give a suppleness to the tissue. So if it increases, it will give more of hardening and more of thickening. And if it gets less, so it will be more of suppleness, more of looseness, right, of the structure at that level. And when it comes to elastin, it is something which is keeping the structure into grip. So if this grip is very strong and it gets more tightened, you will get constrictions, contractures, a stenosis, and a muscle shortness, or what you say, cramps, hemorrhagic diathesis, because this elastin fibers which help in forming the blood clot, they are less. So you will have lot of bleeding tendencies. And if this happens in the other way around, that is, you have fibrin less. So what will happen if fibrin is less? The compactness is lost. There will be looseness. What you see in fibrin less is diseases like lumbar disc prolapse. What happens? That lumbar disc prolapses, just comes down. Then there is elastin less, which is seen in the form of hernia, prolapses, dilatation, and even relaxation of those veins and the arteries. And our disease, which we are going to discuss today, is again a pathology which belongs to the group of elastinless. So that is varicose veins, where the veins get dilated. So what is the difference between an artery and a vein? So as we all know, artery is something which has got a smooth, both has got a smooth muscle fibers which are just enveloping those cavities. But the main function is to conduct or carry the blood. Arteries, they carry a purified blood, oxygenated blood. And veins, they carry deoxygenated blood. Arterial walls are more thicker, so they can bear the pressure which is at higher end in the arterial part. and they do not have walls because the pressure what the arteries have is sufficient enough to give them a push to go ahead, and they carry lot of blood which is oxygenated, and because their walls are very thick and they have got higher elastic content. So when arteries go into pathology, rather than going into elastinless, they go more into, because there is lot of pressure, lot of power into it, lot of oxygen into it. So they go into pathologies like atherosclerosis, where we see thrombosis formation, thickening of the arteries, that is arteriosclerosis over the age of period of time, because they are very highly thickened walls. Whereas when you see about the veins, when you talk about the veins, as we all know, veins, when arteries, when you are talking about arteries are more active, more powerful, more energetic, because they have high tensile pressures. They can bear the pressure. Their capacity to work against the forces is very high, and they have lot of positive blood which is running through. Whereas veins, they are slightly weaker. Arteries, they are lying deep inside the body. Whereas veins, they are more superficial. They carry deoxygenated blood. You can see your veins even at the superficial ends of your body. You can feel the pulsations of the arteries, but you need to go down deep. Whereas veins, they are slightly subtle. They are carrying deoxygenated blood. So responsible for carrying the blood which is having low oxygen. They don't have so much pressure because they are returning and moving towards the heart. So the pressure gradient from the arteries to the veins, it reduces. And therefore, veins require a pressure to push. So you can see in arteries, it is more of positive pressure, whereas in veins, it is more of negative pressure. Not negative pressure, but a less pressure, a less tensile strength. And therefore, their walls have no elastin content or very less elastin content. And therefore, whenever veins go under pressure, veins have to perform against resistance, they easily collapse or they easily dilate themselves because the pressure gradient doesn't hold the elastin part. Whereas we have seen that arteries have lot of high elastin content, and therefore arteries will go into other pathologies. But veins, it is more of passiveness, more of stagnation, more of blood flowing against the resistance. It has to go against up towards the heart, and therefore they need some support. So when you talk about veins, the pathology of veins, you will find these individuals needs support. They cannot push their blood as actively as arteries could do. So this is what we need to understand. Someone has asked in the group that how to understand emotional pathology. So the best way to understand emotional pathology is read what anatomy and physiology talks about. If anatomy says what kind of structure they are built up for, what function they need to carry forward in the life. So as we have seen, veins, they are more passive, they are more sluggish, they are more carrying deoxygenated blood, which needs lot of support to be pushed ahead. So diseases, when it comes at the venular level, you will find more passive kind of diseases. How and where we need to connect, we will see. So as we all know, when you're talking about varicose veins or you're talking about pathology, any sense, when it comes to elastin less. So what happens when it is elastin less? So body primarily is trying to cope up the increased demand of blood. And because initially when we know that my veins are not capable enough to push the blood resistance. So you will see that just like the blood which is being obstructed and one tunnel is not capable of pushing this blood ahead. So what happens is another branches start developing, and these core branches or the collaterals try to carry the overload. So body initially tries to take this defense. You will see a lot of collaterals which are coming up even at the venular level. But once it happens, it goes towards the capacity a vein can carry. The vein, since it has got a elastin which is less in the blood vessels, so they lose their elasticity and they get into more of dilatation. And since they get dilated, the walls which were supposed to work and take the blood flow against the resistance, they just stop functioning and they cannot support these venous system to carry the deoxygenated blood. And because of this result, because of this process, you will see that there is lot of slowness, and this slowness will lead to collection of blood into the peripheral system, and we are not able to push this blood, and the deoxygenated blood gets collected. This can happen even in hemorrhoids. We see that hemorrhoids, when they bleed, they are like purple bunches which are there hanging down at the anal region. That is also because of that stasis, that stagnation, or the veins which are at the anal ring, they get just prolapsed and they cannot sustain the resistance which is being pressurized on their walls. And therefore, there is slowness, sluggishness, and dilatation. So this is what we need to understand when we are talking about elastinless. So when you see the pathologies of elastinless, you will see there is relaxation. Okay. So relaxation at the level of mind and at the level of body. There is viscerotosis. You will see eyes getting drooped. There is prolapse of uterus. There is prolapse of rectum. There is prolapse of so many prolapses which happen. Hernias. The person will tell you that they easily sprain because their muscle tissue and tendons are weak enough. So lot of weakness will come up. So this is weakness, varicose veins, elastinless, laxity of tendons. People come and tell that I want to hit the ball, and exactly when I have to perform, the muscle gets cramped. And those cramps, they are because of the shortening of the muscles, which leads to failure to perform. So at the peak time, when the player wants to hit the sixer, there he gets the cramp because he goes into something less at the mental level. And therefore, this elastinless will give you the pathologies of prolapses and varicose veins. And on the contrary, if elastin gets more, it will be like catching it too tightly. The wire around is so much tightened that I feel suffocated. I'm not able to release that pressure. And therefore, elastin more will give you more of constrictions and contractions, more of stenosis, right? You see valvular stenosis, where the blood flow through the cardiac vessels are not able to push, and there is cardiomyopathies which happen, or because of stenosis at the valvular level, you have so many cardiac complications which happen. You have even stenosis at the level of anal region because of recurrent anal fissures which happen to, and the walls get stenosed, and therefore even the soft stools get painful. There is shortening of muscle. So now, understanding more about the venous system, we all know that arterial pressure is more, so they can push the blood easily to all the tissues. And this is a very beautiful machine which is being formed by the body, and this machine has to work perfectly. So all the pressure gradients are maintained in such a way that this venous blood can maintain the flow at the capillary end, the capillary network, where the arterial pressure and the venous pressure is very different, and therefore the exchange of gases or exchange of material can take place. But the veins are responsible to again push this blood, which is deoxygenated, to the heart. It can be through superior vena cava or through the inferior vena cava. The upper part doesn't need so much of pressure because it is towards the pressure gradient or towards the gravitational pull. And therefore, in the upper part of the body, you will hardly see any venous pathologies happening. but when it comes up against this resistance of gravity. So these veins have got lot many walls which help in forming those pressure gradients, and gradually the blood is being pushed ahead. And what happens is, when you're pushing it against the gradient, when these veins, they are put under the pressure, tremendous pressure of work, of performance, they just give away. The capacity goes away. And therefore, these veins, they fail to take this blood against the resistance and they go on dilating. So elastin less is responsible for dilatation of these venous system. And this venous system, you will find that they are spatially when they are under pressure, when there are blockages which happen. Simple example, where you get lot many cases like patient tell you and that I developed varicose veins, I developed piles when I was pregnant. When that huge pressure of that pregnancy, that body pressure of that baby, I was not able to bear that load and therefore my veins gave away. And since I was pregnant, my veins have never come back to normal. So this is where the venous pressure maintains the blood flow. So you should know what is the responsibility of these veins and how do they function. So normally these veins can bear this pressure load and their walls function so that they can push it. But what happens is, when this elastic, which has got the capacity to hold it in a proper position or in a proper location, but when these veins dilate, that is because of elastin less, and these veins which are now becoming incapable, there is incapability to sustain the pressure. There is incapability of performing what task has been given to us, and therefore the valvular pressure reduces and the blood starts getting stagnated. And this stagnated blood gives you stasis, and this stasis leads to that typical dermatitis which you have because of varicose veins, right? And when this varicose veins is not getting reversible and the pressure of the blood flow continues, one valve has failed, the second valve starts failing, and because of this valvular pressure which is reducing, the blood starts getting collected into these dilated, sluggish and total indolent veins. And this blood, when it gets stagnated, since it is a deoxygenated blood, it will definitely enhance the chronic inflammatory process, leading to secondary infections. And this takes away, because the blood pressure has to take it away at some level. And therefore, the inflammation starts, leading to varicose ulcers and varicose dermatitis, non-healing ulcers, because there is less of good blood supply and more of deoxygenated blood. And when there is lot of deoxygenated blood, the dead tissues over there, they do not replenish. The good blood which must flow towards it stop flowing, and leading to necrosis, or what you say, because of deoxygenated blood, destruction at the tissue level. So when you see at a very primary level, so these primary level, when you see, it's in a form of lot of spider veins, like small vessels which are developing to cope up the pressure. But this coping up of pressure fails, and the gear shifts to the second level, where you will see tortuous veins which are visible. You will see, if in our days we had lot of rickshawalas who would pull those rickshaws and bullocks. So they would usually have these prominent blood vessels, because they had to push that rickshaw against that resistance, even on the highs. So it was very commonly seen in those rickshaw pullers that you would see these tortuous veins. And as the disease advances, these tortuous veins become so fragile that even they start bleeding, and the patient is not even aware that they are bleeding so much, and there is lot of passive blood which can be seen, and it just structures the vessels all of a sudden, and it's a plainless bleed. Patient even doesn't know that they are bleeding. Someone of the relatives will tell them Suddenly there was so much pool of blood. And they will say, I did not realize. That part becomes so hard, indurated over a period of time. You can see lot of pigments which get deposited, and there is lot of stasis leading to, even you will see that atrophy is there at this level, and the skin becomes very thick and brownish, as if a pitted appearance like an orange peel. And over a period of time, this dermosclerosis, which is an advanced stage of varicose veins, they start bleeding, and these ulcers they develop, which gives you an irreversible pathology. So this is what about varicose veins. Now, why does this elastinless has to happen? What is the mind and body connection? How to understand these varicose veins? So it's a very beautiful connection. Just pay attention that whenever you are, what we have talked about veins, that this is about passivity. The veins carry deoxygenated blood. It is about performance, carrying blood against resistance. So they have to perform more than the arteries because they are working against the gravitational pull. So they have to have that confidence within them so that they can work. So if you're talking about pathology, everything has to be opposite. So varicose veins, when you talk about the mind of varicose veins, so the need is definitely an esteem, because arteries and veins, they belong to the connective tissue of the body. And connective tissue, when you classify, they talk about more about the value system is related to the esteem. Just like the bones, the tendons, the connective tissues are also the blood vessels because they have muscular fibers. So their function is to give value system. Their function is to carry the value. So whenever you see a varicose vein patient, you will see a lot of devaluation into them. You will see that they don't have the power to control people. They are elastinless. I cannot make a grip now. So I give away. If I have to hold it, the elastic power has to be strong enough so that it can tie and it can keep people within. But because I lack that confidence within, I'm too timid and I cannot hold people, and therefore it is better to give up. These are the people who will not carry the things so strongly and they easily give up because they are timid people. They don't want to cut up the relationship. So it's better. I don't have that confidence that I can fight against you. I don't have that resistance so that I can carry this blood against the flow. So better I give away. I need to be very flexible enough. I need to be supple enough because I don't have that confidence and I'm too timid to fight against. So better I become. Therefore, the bleeding in varicose veins, as we have seen, it is being unnoticed. It is painless. It just shoots up because they cannot bear that resistance. And therefore, they are like, I cannot carry this deoxygenated blood. It has become so overloaded now. So better is to puncture and just escape from the body part. So they are the people who don't want to face the world. They are cowards. They are the people you will see varicose veins happening, like I said, in rickshaw pullers. Those people who are working into continuous desk job, continue 9 to 5, 9 to 8, sitting in front of the computers, in front of those big file bundles, and they are not able to just cover up. They are not able to express their anger because someone will go and put that you have to do it and you have to do it. I am incapable. I know I'm not able to perform. So that fear that I won't be able to perform, that gives you more of cowardiceness. Better I should not face because there is passivity. So they don't want to, they don't have that courage even to face. There is difference between timidity and cowardice. A timid person, if given support, can at least try in their life, but cowards, they just have escape mechanism and they will never face the world. They will just run away from all those situations which are conflict oriented. Because these are the people, because varicose veins are passive, so these people are more towards the passive end of the life. You will see many people are more obese. They want life जैसी चल रही है They just want to continue with the life. They don't want to have or create hurdles. They don't want to create hustles in the life, and they just are overworked. They are overburdened people. And because there is stagnation at the level of the veins, even you will see the slowness, sluggishness, which is seen at the level of the mind. Even you will see the slowness, sluggishness, which is seen at the level of the mind. They are the people who will not have very high intellect. They will be more towards the apathic part, or the people who are more towards, rather than saying indifferent, they will be more of indolent people. More people who are slow, more people who are less energetic. So they are apathetic and sluggish and lazy and indolent because veins have less pressure. So these people also have that less capacity to bear anything which comes as a stress to their life. They cannot fight with the people who have even hurt. They are so coward people, they are so timid people that they don't have that courage to express the anger in a right way to the right person in a right place. So what they feel is, rather than facing these individuals, it is better to escape. So who they don't have that capacity, there is a very beautiful rubric which is given as they are not able to give or forgive the people who have offended them. So they will be from those categories of those individuals who cannot forgive because they hold on the grudges. They are the people who don't have that courage to ventilate that anger. So all that anger gets just accumulated, and you will see lot of behaviors which are like they will never barge the people because they don't have that courage of barging the people. It will be more of holding that anger within, and because of that timidity and cowardiceness, they will never resolve their conflict even for years together. And they have a lot of passivity of emotions. So you will see in these cases, emotions don't just flow into the cases. You will see a lot of passive emotions. You just understand, not able to express. I have a patient who will be like, why husband is trying to dominate in front of me, and she will be like, ठीक है अब जो बोलना है बोलो. They are like, they become very resistant, they become very obstinate people. They won't listen. You tell them, please, they are so passive now, they enjoy their comfort zones. So you will see a lot of carbons coming up when you talk about these varicose veins. So because of stagnation, laziness, low energies, therefore carbons group come up, calcareas will come up, right? Now, because they are having that lack of courage, so they get easily dominated, and they are the people who will be obsequious because I am timid. So the adaptation which they will have is jihazuri. Okay, fine, smiling, showing that false image in front of you that I am so devoted, so dedicated, so obsequious, what we say. So they are like people who lack that courage, lack that confidence. So not out of that reverence, they become servile, but they become very too timid, and therefore they have to give up. And therefore you see that they are very servile. People easily, they feel that people use me because I am a person who cannot say no to anybody. And I'm a person who cannot resist that force which is coming upon me. And therefore it is better, I cannot have those conflicts, I cannot fight. So better say no to anybody who poses that resistance to me. I know in spite of working hard, I cannot raise my position. I feel that I'm being devalued. That devaluedness is being seen, that they feel they have given their whole life to the family. They have given their whole life to this world space, but no one gives them thankful. No one feels that, yes, you have done that. No one feels their value, and that devaluation is being seen, that they feel they are being not appreciated in their life. So you will see a lot of cases where you will see delusion not being appreciated in their life, because it is not only because they lack that courage of seeing themselves. They see themselves through the glasses what others wear. because they don't have confidence upon their self, and therefore they need support. They are the individuals who need that valvular support. So they see themselves also through the eyes of others. So they never feel that, yes, I've done something in the life. They always feel that no one has appreciated me. So they keep on cribbing about that no one has appreciated. So they feel that they are not being valued in the society, in the family, in the world where they have given their life. And as they retire, they feel more and more of devaluedness. And in the family, when they are being devalued, they cannot break the relationship. They want to continue this relationship because it is a strong support. Since childhood, they want this family to be bonded, and therefore they just keep on bearing the load, the pressure which is being pushed upon them. And at the end, they feel lifetime I have served them. Still, no one has valued me. So they are the people who always need support in it. And therefore, there is lot of indecisiveness and irresolution in them because they lack the confidence to take a firm decision and stand firmly on their foot. They are more mild and obedient because they can easily dominated. Since they are more into passive side, so they are the people who are weak-willed, who have lack of confidence, lack of courage to fight back. So it is very difficult for them to push it ahead. It's just like if I'm tying your leg to certain thing which is very heavy. I'm tying your feet which is sticking it to the ground, and you're trying to push it. You need lot of resistance. The capacity of just pushing this wall against this resistance is too high. So they feel their life is stuck up and they cannot move forward in their life. And because they are incapable of just giving this one push, they just give away that I cannot do anything ahead in my life. So better I should stop at whatever position I am. So therefore, there is more of stagnation. So there is also a feeling that since childhood, since my birth, I've been always doing so much for the others. I've been working so hard, but I am so coward. Am I so lack of confidence? And because of which they feel that my life has become a hell. I have been so unfortunate enough that in spite of giving so much, I cannot attain that peak which I wanted in my life. I'm unable to hold the whole family which I wanted in my life. I am not able to reach that peak of my life which I deserved. A rickshaw puller throughout the life has shed his perspiration just like his blood, and still what he gets as a value to whatever efforts he has given is just a penny. Is it worth of what they have functioned? And therefore they go into that misfortune feeling and that unfortunate feeling and that stagnation which hits them, and therefore they start feeling that they are being obstructed in the life. They feel that life is being stuck up, as if they are being tied their legs to something from which they are not able to move ahead. And this delusion that doesn't make them feel free. And they feel because of these responsibilities of over my childhood, this work which is being pushed upon me, I am just compromising my energy, and I have actually not lived my life anywhere. They become so passive and so low energetic that even if you tell them, please go and have a walk, please go and have a movie, enjoy, and they will be like sitting on the couch. No, Ray, I'm now enjoying my work. I just love this routinistic life of going to the shop and coming back from the shop. And after coming from the shop, no one can tell me even to move a bit because this is not me. I don't want, because I have already compromised my freedom in my past. And when there was a time where I could have flown, I could have enjoyed, I was so passive, I was so overburdened with this responsibility, I couldn't enjoy my life. They are the people, because they have that devaluation and because they lack that freedom, that stuck up feeling, that unfortunate feeling, they feel they become so fragile. I said now, those veins when they become so stagnant, so dilated, they become so fragile, they just ooze out the burst the blood, because they are then become sensitive to those insults, and they feel that I'm dependent upon you. I have worked out throughout my life, and this is so frustrating. And they therefore, because of the devaluation, they have that insult feeling deep down, but they cannot express because they have that lack of courage. They feel now the situation of my life is not under my control. I'm so unfortunate. I lack that confidence to fight it. So better to accept. And I feel that I cannot change. I cannot do anything in this life, giving you that helplessness, that hopeless feeling in that life. And they will say, nothing is under my control. Everything is what God controls, or even my family controls, or my boss controls. I'm not the boss. So even I'm not the boss for my life. So it's helplessness. So they can easily forgive people who have hurt me. But important is, it is not that forgiveness from the heart. It is like, I cannot fight back, because they are not able to fight back. Therefore, they show to your face that they have forgive. But deep down the heart, you will see lot of grudges which are being held on. You will see that they get offended very easily and they cannot forgive by the heart. It is just the psychotic defense that they show, that they have lot of tolerance within them. But when you dug down them, it is really very difficult to take the case of a varicose veins patient, because it is lot of psychotic defense which they adopt, and they will never tell you what is there in the heart. And when you take the cross from the family, then you will see they will always tell you they are very happy go lucky, very smiley, very like that. But when you deep down go, you will find the family will say, my God, they are so crippling, they are so irritable, they want everything to be done. They're obstinate people that they don't even listen, but they won't even give back to the things. They will just tolerate. Whatever you want to do, you do. I will not listen. This is the state what they have. So they lose that confidence, and therefore they cannot fight back. And better, rather than fighting back, because they don't have that courage, is to let go the things. So they are discouraged and discontented people in their life, and you will see lot of grudges, crumbling, and frowning on their faces, lot of obesity coming up, because lot of insecurity has been mounted upon them, and they have built a facade. Psychosis is what? A facade. Sir would always say, there is a saying, what you see is not the truth. जसं दिसतं तसं नसतो, म्हणून त्या जग फसतो. This is the saying in Marathi, ki what you see exactly is not the reality, something different. So what you see as a person, they will say ki I'm so happy, so everything is good, everything is going fine. No, they are discontented and discouraged people because of that elastinless pathology. So if we go and refer GNM, GNM also says that the conflict is like the ball which is there, a self-devaluation conflict, and the leg is being a ball and a chain conflict. Like what I said, that they are being trapped in their own emotions, they are trapped in their past, they are trapped to their word. They are routinistic people who feel that my life has become stagnant. Now I won't be able to move ahead in my life and support my family, because this huge burden of responsibility which has come over my head, I won't be able to overcome it, and this will really make my life a hell. So therefore, they are like hanging healing in the leg veins. That is a continuous conflict relapses. The leg falls which prevent the flow. So with recurrent repair processes, the walls become scarred and porous, resulting into the veins which get thick, and the gradient pressure which becomes more slower. And therefore, this is what we have to understand. This person is being tied to that huge wall which doesn't allow them to go ahead in life. So this is the delusion that they are being trapped, the delusion that they are being obstructed in their life. So friends, let us take one case. I would like to show you. You will see the pictures and just see the differences which I would like to show you. This is a case of varicose veins See, this is the patient who has come to me since 20 years. He's been suffering. He's a person who is a shopkeeper with a continuous standing job. So you can see the right foot is more being affected. You can see the discoloration. You can see the stagnation which is there. You can also see that the veins which are like the spider navy what we have talked about. So they are also present. So there is lot of tortuosity which we can see. The veins which are getting prominent. So the veins which are getting prominent and discoloration which is there at the feet level. See, but less of edema which is there. There is not more of edema. He says he has slight pain. These veins are more tortuous. Okay. At this level, you can see a lot of pigmentation which is there. So this is a patient who had come to us with, he says that since 20 years he's been suffering and there is less of complaints, no major complaints, and there is black discoloration. Itching is somewhere, sometimes there. He has hyperacidity. He is a classical case of elastinless because he has been operated twice for hernia, operated twice for fistula in ano and hemorrhoids. He also has reduced hearing. He is a person who always had dreams of friends and sexual thoughts. He says it is very obvious. I see so many females around me. So if I see females, I tend to see those images in my dreams. I even see that I have taken extra money which I need to return. So I'm so honest, doctor, ki even in my dream, I feel that I cannot cheat my customers and I need to return that money to them. So I am too honest and too truthful. And I'm a person who will never take risk in life. I enjoy the life, like I sleep in my own shop. From my shop gets closed, it is in the morning hours and the evening hours. In the afternoon time, 2 to 4, I take rest. I have my lunch. I'm not a person who will just work here and there, run here and there. I'm a person who is very safe, secure, wants to be safe and secured in the life and avoids trains. I also even avoid crowds. I avoid traveling because that makes me anxious. If I have that urge for urination, I won't be able to control my senses and I might have involuntary urination. So better avoid traveling. Does not want any trouble in my life. Since childhood, I had lot of financial struggle, but I was very happy person because for me, happiness is more important. For me, honesty is more important. Life should be at peace. I don't want those people who are just like want phone and mobile. I'm a person who wants harmony and peace always. I would never look into the differences. My family had lot many differences, but I never paid attention to it. I was being kicked out of my family. We were very young children, and because of some family dispute, my uncle had kicked me when we were very small. So my father struggled a lot. We were into the roads and could not express my anger towards that uncle and auntie because they would always suppress us. They would always torture me, and I would a person who was very passive enough and never got the chance to express my anger also. I was very helpless because we were being kicked out and we were on the roads. And one fine day, my father took loans and to bring our children because we were family of 5 people. So it was a huge responsibility which came upon the head. We had to compromise our education and join our father for earning the livelihood. So it was a struggle since childhood. So we were the people who were very honest. So today also, I don't want anyone coming to me and asking and demanding money. So I play a very safe game. I don't have lot many demands in my family. I don't give lot many demands, and therefore I just want to keep it to myself. And I want to be satisfied in the family. And he says ki I don't use lot of electricity. I have a small cooler which even I will shut off just because one thought is ki electricity has to be saved, and the other thought is ki those people who are coming to me from sun, immediately they should not be harmed. So I am a person who will think for others. I am sympathetic. I would like helping people. And since I have been hardworking since beginning, but still I don't want hustles in my life. Father was very strict and he would scream and shout even over small mistakes. So I was a person who was very timid and was being dominated by my father and even by my siblings. My elder sister, she had always taken a role that she had always dominated me. My bua had always dominated me, and they would be the person who would get everything in the first hand. And I was very timid. So I was being neglected and I was being demotivated. It was just like since I'm growing, my life is just getting dug up in that pitfall of the earth. Tremendous pressure. There was conflicts because of her, his paternal auntie, that is Buaji, who was creating lot of hurdles and problems in the family. So he feels that such should not things should not happen, and family should be bonded enough and try to fight for all these things. So I'm a person who doesn't like that loud noise, that fights and that quarrels which used to happen. So I would just avoid them. And that auntie, that sister, they just keep on interfering. Are you are got married? Why you have to come to our home and create those hustles? So I am a person who want to forgive everyone. I have joined some guru and I am a regular I'm a regular follower of the preachers of God. So I just don't want to hold these grudges and I want to forgive everyone. I was very average student, not very intelligent in studies, so never forced my parents for further education. Since my life was very hardworking, I had very few friends. I like maintaining relationship. I have relationship even with my teacher. Now she is 80 years old. So I need to talk to her daily because she always give me support and keeps on guiding me. So I want to maintain relationship with such people who give me right direction. I have conflicts and I keep adjusting. Now I feel how much do I need to adjust in my life? Since beginning, I'm taking responsibility of my whole family. But what they did with me? Did they actually give attention to me? Did they kept on hurting me? But I cannot hurt anyone. I just keep that anger suppressed because I cannot fight. I cannot even express my anger on others. So better is just like a child. I just scratch my head or hit myself. Practice in extreme, not very often. This is what the youngsters talk these days. They have so much of slang language which I don't talk and which I don't like. So I feel that they don't never value how to explain them, how to respect others. So I was a person who was being always dominated by father. So this was the whole journey. So as we know that this is confidence was always poor, feels that others were more strong and effective, cannot express emotions. So an introvert person, rather than introvert, I will say that he was more of timid personality, contented, query, doubtful. Because I won't say that he is really contented. He uses the word that jitna hai usme chalana. But I felt that he did not have that courage to take risk in the life and just be so ambitious, because for ambitions to be completed you need that intellect, you need that direction, that risk taking attitude in the life, that you can go against those hurdles. So he seemed to be a contented person, but when analyzing his sexual thoughts, if he would have been those contented person, he would not have those extra sexual thoughts. He said, I was married to a lady who was not satisfying me, who was not helping me out so much. So it's very obvious to get these sexual thoughts when I see other females. So this is the part of psychosis when you're dealing with such cases. The psychosis is not something which is very much visible. It's beneath that undercover of false facade. They create a falsification, a false image. So he created that image in front of me. So friends, this is the case number 1, which I've shared with you. Right. So let us analyze this case. So at the level of mind, I always have this habit of correlating mind and body. So what we see is that he is a fearful, a timid person with confidence, want of forward, who wants harmony in life, sensitive to rudeness, aversion to quarrels, mild with sexual thoughts, right? Then at the body level, we see that the disease pathology, as you will see, that varicose veins have not crossed the level that they have never bleed. They never had those varicose ulcers. There was no suppuration. The varicose veins are at a very settled level and they have been very chronic, slow moving and with lot of stasis. And because of stasis, you can also see that yes, stasis has given you pigmentation. And so this case is of more towards psychosis, which is slow moving. So as we all know, when you talk about the miasmatic correlation, if you have a very clear picture of what miasm you are dealing with, we know that this case is slow moving psychosis and not towards so much of syphilis. So here we will not need a remedy which is a phase remedy. Definitely we need to repertorize this case so that we come to a remedy which is more of psychotic and plus which is the genetic constitutional simillimum to this case. Because sir has clearly mentioned what tools or what gun needs to be adapted when you're fighting that battle. So in varicose veins, in such type of cases where the disease has not advanced, it is in the primary phase, or in spite of so long duration, the disease has not progressed to that destructive pathology. So still it is in the stage of psychotic defense, where is dilatation and lot of stasis. So we need to analyze this case with that glimpses or with that reflection of psychosis. So we need to give here will be, rather than a phase remedy, we need a constitutional remedy which needs to be given. So here the remedy which was prescribed, I go ahead with another case. Before going to that case, just remember this totality in mind and we will go to case number 2. You will then differentiate what totality differences we had and how to move ahead. So this is a case of 58 years male who had come to me with veins, but the veins were very scary. The pictures were very scary, and I will tell you, the pictures were so scary that multiple ulcers which were deep down, and these ulcers were not healing. This was a picture which was taken days after the treatment had started, because initially when he had come to us, the ulcers were so bad, so offensive, that they were resistant to all medicines and treatment. And since many years he was carrying this. This was through the process of healing. When he had that healing process, see, you can see this dirty look because of suppuration, the stagnation, the skin is getting thickened, the varicose veins which are there, the perforators are failing to give way, the ulcers are very deep, non-healing ulcers, and these wounds would not heal even with the medicine. There were many pores, itchy discharges, gluey discharges, and he would always tie his legs because he would have constant oozing. He is a shopkeeper, so he has to work constantly. These are the ulcers. See, dirty look. The tissues are getting destroyed. The bloody discharges. But since it is because of varicose, it is not active bleeding or red colored ulcers. The granulation tissue is very poor. This is in the healing phase. These ulcers are in the both the feet. See, this is the puckered look of the skin, glistening because of chronic edema. This is after giving the medicine, how healing had taken up. The healing process had started. So pigmentation reduced, the ulcers started healing, the discharges reduced. This is the post-treatment. These are the pictures which were taken gradually. The ulcer size reduced, and the most important thing is the Hering's law which came up in these cases was really wonderful. The discharges reduced gradually. The intensity of ulcers started healing. The wound started healing. See, this is where the body started reducing the wound. See, the ulcers, they had healed with the medicine. This is after the treatment. The ulcers which were deep, multiple have healed. Now he has no ulcers in his feet. His foot is very clear, very smooth. The skin has come almost depigmentation has occurred. The blackishness has reduced. The edema has reduced. This is before the treatment. See, the healing which took place in these ulcers was this way. I was very surprised. I was really very, I'm presenting this case to you, but in the healing process, since the pictures are here, such things came up. This was the first time when I was seeing a varicose ulcers healing. So I was wondering, ki, am I going in a right direction, and why so much of tissue is coming over here, and why these bubble-like structures are coming over here. But when I observed it very clearly, I found out that those ulcers were very chronic ulcers. So they needed lot of fibrin tissue to get deposited for that healing process. And gradually, when these bubbles used to come, he would complain that now I don't have any pain and I am really feeling very fine and very active now. And after this bubbles, the skin would heal like this. So whenever these bubbles used to come, I was very happy. See, the bubble healed in this way, and the bubbles have not even left the scar. The bubble had just cleared themselves, and this was where the syphilis, as a primary defense, where there was ulceration, has healed itself through psychotic process, and syphilis shifted to psychosis and psychosis to sora. The depigmentation had also occurred. So this is how the healing had taken place, and now he has no ulcers, no wounds which are there, and it has completely come back to normal. Even you can see the pigmentation has come to back to normal, and now he says ki, I'm so much relaxed after so many years. I'm living my life without bandages. So this is the case which we were talking about. So this is a case which is of a chronic diabetic patient with non-healing ulcers, and he said ki, I have undergone skin grafting with varicose veins which was being operated also, but they have got no healing and no cure. And since 13 years, almost now and then, I have these frequent ulcers which are coming up, and I am a person who has been continuously into work, so I cannot take rest. He is an obese person, a person with a smile on his face, very cheerful. He is a secondary extrovert. He will just come on the chair, his stomach will move, a very hefty person, and with a smile on his face that everything is fine. Don't ask me questions. If I'll ask him, how are you, uncle? He will say one word, everything is good. So not much telling anything. The case was like, yaar, karna kya hai? He is into that phase of syphilis, how to heal it. So everything is good. He was an obstinate person. Even the son says he will not take any efforts. He will just go according to the clock, go and sit in the shop, come and back. His childhood was also under struggle. So he had to join the shop very early because of the financial crisis. Being the eldest in the family, he had to take up the responsibility. And since he was not good in studies and not interested in studies, father pushed him ki better you have to join the shop rather than moving here and there. So he would always, he has a tagline, सब बढ़िया है, सब खुश है, सब normal है. He says कि only I have problem is with the shop. I don't like today's children. They are so much. He has one son who is into architect, but he doesn't come to the shop. And this is a person who is more into his business, and he wants that today's generation also should join the hierarchical business what we did. And he's a person who has like he can, and he says ki I was a person who was very calm and quiet, but dimag, if someone doesn't work according to me, I have one helping hand. If he doesn't work, I am the person who's sitting on the chair continuously, or jitna bhi ghumna hai, I am into that my small space of that shop. So I don't go out even. I don't go out for outing. I don't enjoy. This is my life that I have been continuously into this shop since 40 years of my life. So if anything goes against me, I get angry. But I am a person who will not express my anger so violently. One more thing which son told us was that we were into joint family. And he was the person who had always taken an initiative of taking responsibility of his younger siblings also. So he was a person who always felt that I was responsible towards my family, and we were into joint family since so many years. But since बच्चे बड़े हो गए, तो we had to get separated, and my father never wanted this separation. So even while narrating about this family separation, he said कि मेरा दिल दुखता है, and he started having those tears. This was the point where he could express his sensitivity that actually I wanted that joint family into my life, and I never wanted that separation to happen. So I was a person who always brought everyone together, and now everything is getting shattered and scattered. Even his wife said कि he is a person who is very jolly and he will just pass comment to the children of my brother-in-law or his brother. Those children don't like those comments. So I always tell them कि अरे तुमको क्यों बोलना है, उनकी जिंदगी है, उनको जीने दो. Give them that freedom. And he was like, it is my responsibility, it is my family, and that family should give me importance. But I feel that today's generation is just neglecting us, and they don't give importance to the elderly people. They don't have that reverence what we had towards our elderly people. They never value. Though I was the person who was being always supporter of the family, and I feel very helpless in this situation because I know things are not going against as per my wish, but I don't have that courage to go and tell my brother that you have to follow me. I'm like, it's okay, yaar, ab jo hona hai ho jaye. I've become more passive. I feel angry, but I don't express my anger that way. So here also in analysis, so he's a reserved person, workaholic, attachment to family, responsible, careless towards self because he will never care about his self. Even his bleeding ulcers, his oozing ulcers, he would just tie with some bandage, that too not very hygienically, and he was not bothered even कि क्या चल रहा है. His son was more anxious. So he was very much disappointed from his family, and he felt that small things about the family really hurt me. And definitely he was responsible and conscientious towards his family, and he feels that his family has not appreciated, he feels worthless, that whatever life he has given, he doesn't get that respect in that life. He feels worthless, that whatever life he has given, he doesn't get that respect in that life, so he feels not being appreciated. So in the body, we see that these varicose ulcers are non-healing. Since these ulcers, we see that they are in the non-healing phase, and you see a lot of oozing blood we can see in these cases. So definitely the gear of miasm is not plain psychosis. This is psychosina. You see deep ulcers, you have seen the rough borders, the dirty look of the ulcers. So that is psychosyphilis. So when syphilis comes in, this is a structural pathology. The physiology has shifted from physiological defense to the structural pathology. So definitely this case will need a different tool to deal with it. Now, case number 1, we have seen that was psychotic. Case number 2, psychosyphilitic. And now we will see another case, that is another case of syphilis, where you will see another male who had come to us with this non-healing ulcer. You can see tying bandages because he had so huge ulcers, and that too not one ulcer. He said that I have multiple ulcers. So these scars you can see on my foot, they are the recurrent ulcers which we have. And this is the photo which he had shared with us. He said that I will share this photo with you because this is what it was before. He had undergone too many surgeries, and still this wound was very huge, not ready to heal. This was the exact phase when he had come to us. So you can probably the second follow-up, because the first follow-up he did not give the photograph. He said it is so bad I don't want to click a photograph, and he did not permit us to take the photograph also. So this was the ulcer which was there, which is very deep. So this is Doppler study, which shows that there is incompetency and thrombus in the left popliteal vein, and perforators are also being there, which are also dilated. So this is thrombus within. So this is in the very advanced stages of varicose veins, and therefore these wounds have stopped healing. These are the other investigations which he had undergone with, and he had brought to us that I have gone with so many treatments and still I am not being relieved. So doctor, if you can help me, I am hypertensive. This is also a fellow who had undergone surgery, and he also had a past history of non-healing wounds, and his wounds will stop healing. And so many surgeries, even went to a plastic surgeon, went for that venography where he wanted to repair those veins. Still, nothing could help him. He had history of hernia and hydrocele, again telling you about the elastinless pathology. So this is the non-healing ulcer or non-healing wound. This is what happened with the treatment. If I will say that this is also a person who was very extrovert, he was being referred. This was, see, all these three cases of varicose veins were being referred by a single person who got that cure, because he said that my case was incurable. So I want you to even relieve such patients who have never been cured of these varicose veins. So without surgery, you have done miracles through homeopathy. So please continue, help these people. So I had many cases of varicose ulcers and veins coming to me. So this is also one of the case who was very extrovert. He belonged to a lower socioeconomic condition. He said that I have dreams of dead people. Even I have dreams of snakes. I have a very poor childhood, doctor. Please don't ask. I feel very frustrated and angry when anyone talks about my childhood. I was very young when my mother died. We had that struggle of our meals. Though we had a joint family of 23 members in the family, still we didn't have that food, proper meals, so that we could fill our stomach. Only we could get proper meals when my brother started earning bread and butter. But my struggle life did not end over there. My father got second marriage. Still, we did not have a good family life. I did not even remember any time in my life that I have played, because there was no time to play. And if I told this to my relatives, they would always say, this is life. You need to learn how to enjoy the life at this moment also. But my life has been very miserable, always neglected us. He would never pay attention to all the livelihood. So we were like orphanages living in that village. Only my family was my brothers and my siblings. I had many friends outside. I was an average student in school because my main struggle was earning my bread and butter. I was very hardworking, work day and night so that I can earn livelihood for my family. I had responsibility of my family. I was younger. So my elder brother got separated and he never appreciated my work. I was the fellow who was living in that village, collecting that cow dung, cleaning the house chores, doing everything in that small village. My brother too just left away and he shifted to the city. I was the person who was left behind in that small village, struggling my livelihood. But no one has even given a heck. Yes, you have done a lot many things. So there was no one to support me. So how can I forgive? How can I forget those days? But still, I know that I cannot have any grudges. No one is there to tell that yes, you have done good. My life has always been so much of struggle. Somehow, I got married. My better half was good. She was a supporting lady, but a very irritable lady too. But she was also equivalent hardworking. I did not have the courage to start a shop, or take a risk. But my wife supported me for the business, and she was the person who started the small shop we have now, from where we began our new life. And now we are fine and settled. I have lot of grudges and anger because my life had been a hell. And every time I had to struggle a lot. And I am a person who is very irritable and cranky now. I really cannot tolerate the misbehavior of my customers, and I really express my anger and react very easily. Even my wife notices this. But I don't like those quarrels. I will just express my anger and just give away. To my brothers also, I've never expressed my anger and I've never fought even for my property matters or something like that. I just avoid those conflicts. I have one major grudge in my life is that I never had a male child. Whenever we had a male child, the child was being aborted. There were 2 to 3 abortions which happened. Whenever I felt this question came to my mind, what did I do wrong? And why did this happen to me? Since childhood, I was very struggling. So, have I done something wrong? So, someone said that this is your past life karmas, and because of this, you have done something wrong in the past deeds, and therefore, you are being punished because of this. So, because of that, I have joined one religious group, and which keeps on telling me that you have to pass those karmas and just bear into this life. I used to feel that someone has done black magic upon me and therefore my wounds are not healing, or therefore my life is at a hell. But nothing worked. I even went for that. But nothing has helped me a lot. And see, you can see the wound. It has not healed. I'm so frustrated with this. Every time I have to look forward and this gets stuck up. Even my wife is not well. But because of my wound, I cannot help her out. So everyone says ki you will never get better. So is it so, doctor, that I will never get better? So this was a third case, and I will show you that this case, after giving the right remedy, this was in the last month, that is 4th month. You can see the size of the wound, and in the beginning it was more deeper. See the pus which has really reduced, the margins which has started shrinking, and the granulation tissue, which was a dirty pus, has reduced. And this was the follow-up where you can see the wound size. He was very happy and he said that after many years I can see that my wound has started shrinking, and there is no discharge now. I can keep this wound open, and after many years I feel there the pain has also reduced. So this was a case of psychosyphilis, and after the right remedy was given, see, I want to tell you people is the way we have gone through these cases. So in coming to the back to case number 1, anyone would like to share the totality for case number 1, which was a more of psychotic case. So this is case number 1. And in this case number 1, you can see that this was a timid, confidence, lack of case, coward, and who wants harmony, who had never fought back. This is a case of low confidence. We need to prescribe a GCS over here, and a person who had never taken the risk in life, who has never fought back, who is always timid, who always showed that I am very contented. But yes, this is not contentment with sexual thoughts, not going with other things, but still a remedy which is very timid and into the psychotic plane. So we gave him Calcaria, and after Calcaria, the person says yes, after giving the remedy, this is almost 1 to 2 months after giving Calcaria, the person started feeling that the pains have started reducing and I have become more active. Before, I used to get sluggish and get sleepy and drowsy after my meals and would require sleep of 2 hours. But now I have become more active, and definitely this remedy has helped me, and the pains which I used to have and that's pains which was there with the vessels has reduced. The remedy which we prescribed, because he is a short statured personality with a smile on the face, not very hefty, so I gave him Calcaria Phos 200 one dose. No repetition have been done, and we can see the depigmentation has started happening and the color has started reducing over the limbs, and he has started feeling better. So this was the first case. According to the stage, we need to learn what tools need to be prescribed. Because it was a complete psychotic case, we don't need so much of repetition. We need to wait until and unless the progress stops. So we need to observe the progress of the disease. If the progress stops, that time we might need repetition. But since the progress is there ongoing, we have to take the hands off. But here the Calcarea has helped. The other remedies which I thought was even pulsatilla is a very good remedy for varicose veins and varicose ulcers. You will see it coming up in the varicose ulcers. But pulsatilla's expression towards family will not be like this. There will be definitely a VP disposition and more of timidity. This person has taken the responsibility of the family without much expectations, though being devalued by the family members, still he is ongoing. So in these three cases, we have seen that definitely there was devaluation. These people were more responsible, more work-oriented people, not so much into outer world, but more into their own world, more attached to the family, more attached to their work. Rather than lot of socialization, you have seen they are more into their own world, and they feel that what we have learned in the emotional pathology, that they feel that they are being stuck up into their responsibilities. It is like they don't want to move away now because they feel that they are being burdened with those responsibilities. So this is case number 1. Now in case number 2, where the pathology was shifted from psychosis, there was hardly any SORA, he was diabetic, more of psychosis, moving towards syphilis. So definitely the strategies need to be changed. Here, rather than giving a genetic constitutional only, we need to cover the syphilitic part also. So I took the rubric over here was the veins, varicose ulcers which were there. He was a person who was discontented and displeased by the people because he feel that he was not being appreciated. He is very conscientious about his family. He is a family oriented people. But in family, he feels that my family members never valued me. He feels that he was a person, in spite of giving so many years of my contribution towards my life, still my family doesn't appreciate me. I have not got back what I used. The new generation doesn't respect me. The new generation doesn't owe respect to me. So when I saw this rubric that he is being not appreciated by the family, that the rubric is delusion of not being appreciated, and there the remedies are there. So if you see this, you will see that here there is Hamamelis which is there, and you will see the other remedies like palladium is also having the delusion of being not appreciated. But palladium is one of the group of metals which feels they are at the highest quality. They are over pampered children who are being spoiled brat, and they feel that they are so kingly and royal, and they feel fragile that they are being not appreciated. Even Thuja doesn't feel, because of psychotic behavior, he doesn't want to take that courage, and they are also cowardized people. So the remedy which was being prescribed was definitely depending upon the syphilitic criteria which he had. So looking forward to the rubrics, there is a single rubric, single remedy rubric, that his family doesn't give him appreciation and expect others to pay respect, and therefore veins in the intestine, and because of the intestine he had melena and severe iron deficiency anemia. He was being advised that he should be given those rings pessaries which was to be implanted inside the intestine so that the bleeding should stop, and those walls which are failing, the veins which are failing, that should start recovering. So the remedy was even prescribed to him was Hamamelis, because he had devoted his life to his family, to others. He had been working very hard. He's a timid person, but never felt that he was being appreciated. He worked 12 hours, but he hardly earned few pennies in his life. He has no savings left over. So there is lot of insecurities. So even in this case, we saw that the young generation doesn't pay that respect to the uncle who has given his whole life to the family. He has never enjoyed anything in his life. So Hamamelis is also one of the beautiful drug who you will see that they have that embittered feeling, but because of the timidity, they never express it. And therefore, they go into elastin, less pathology. And this elastin-less pathology gives you varicose veins. And these Hahnemann is having a very beautiful drug picture where you will see that they are people who are very conscientious. Definitely they want to sublime, they want that someone should listen to them and someone should come and listen and talk to them, but they are not being listened, so they become dissatisfied and discontented with everything, but they don't have that courage to express that discontentment. So they are very confused and dull intellect, they are forgetful, they are heedless because they give less importance to the important things, and we feel that they are heedless means not being fearless, heedless, this is what we say. But this is not that heedlessness, because they lack that courage and therefore they are more into indifference. They are indolent people. They cannot go into physical exercises. They will go into passive exercises. They might go into meditation, but avoid all the physical activities because they have aversion to work. That is not work. That is aversion to physical activities also. So they have mistakes while speaking. So this uncle also avoids talking. So they have reverence for those around him, and he feels sad and misfortunate because people don't give that importance. So he goes away and doesn't want to give respect. So this is what we also saw in our Hamimelis 200 ka patient. And since the ulcers were very deep down, ulcers, they were not healing so well, they are visible. I am over the Hamimelis slide only. I'm trying to give you Hamimelis ka drug picture ki how they are as a person. So they are at the mental level also and emotional level also, that they feel that they are not being appreciated or not being given respect by the people around them. So this is what Hamimelis is. So they are conscientious, discontented people, and they are very heedless people. They feel the delusion of not being appreciated. In Kara repertory, delusion not being appreciated is a very small rubric. So I had to take the reference from radar, where I had shown that radar has that rubric of not being appreciated. Then in the third case, now let's enter the third case, where there was a strong syphilis. We could see that this was a deep non-healing ulcer and a recurrent tendency of going into ulcers and wounds which have got the tendency to pus formation. So we needed a remedy. See, the differences is in all the three cases. When we saw the case number 1, which was still in psychosis, so lot of passivity we could see. So we needed a remedy tool which was with a single dose, a GCS could help you, right? But when such ulcers come up, like even in Hamimelis case, I needed 2 to 3 repetitions. Why repetition was required? Because as I have shared with you, this is an overall progress I have shown. See, ulcers which were very deep, which were very ulcers, and this is after Hamimelis which was given. The ulcers, they started shrinking and the wound started healing. So when this phase came up, which I have shown you, ki this has started drying up now. When I repeated the case, I will tell you. This time I had to repeat because they said ki 2 wounds have started healing, but 1 is not healing. See, this is the picture before. This ulcer when Hamimelis was prescribed, and this is when the second follow-up, the ulcer had started healing. You can exactly see the depigmentation also. But what happened is, when that psychotic phase came up, which I have told you, this was again which has reappeared during the course of time. So I had to repeat 2-3 times. Hamimelis was repeated. So you can see comparatively these images which show that these ulcers, when they go into that healing phase, the beautifying remedy of Hamimelis has really brought this back to normalcy, and we can see the healing taking place. And I needed repetition when the case came to this stage where there was a stuck up feeling. The patient said ki now I can find these ulcers have shrunken up, but still the wound is not completely getting cured. This was the case. And at this time, I repeated another dose, and so 2 to 3 doses were being repeated in these cases. And this is how the cure process has taken place. And you can see the ulcer completely going off. And this is the bubble like tissue which I have talked about. And this granulation tissue, especially in varicose ulcers, when I searched over net, when the cure process comes up, this is what healing takes place. And this is where the healing has taken up from syphilis, the reversal to psychosis. And now I will tell you ki he has started telling us that now I can feel thoda sa knee pains, slightly some gastric symptoms, but his blood sugars are absolutely fine. Everything is going fine. I have not yet repeated another. I gave him lycopodium as his GCS later on when the cure process was very good. And over a period of time, the ulcers have completely healed. There are no ulcers since last 5 months, and this is the cure which has taken place. Lycopodium was given as a GCS later on when there were some new symptoms which had come up, but those symptoms were very psoric symptoms and they required GCS. So GCS, as a GCS, we had given the remedy, and the sensitivity part also came up. And now coming back to this case number 3, where there is lot of syphilis, you can see that this ulcer has got a slough, a bad looking ulcer with lot of slough into it, and this slough has got lot of pus which is thick yellowish pus which was not letting the wound heal. Now why does this pus forms? Why does the body doesn't get the gear of not healing? Why doesn't the body saves himself, and why does so much pus has to get collected? So this case, you need to understand ki this is something where he does not allowing in the brain also, in the mind also, ki I don't want my wounds to heal. Because the grudges, the childhood he had, the pain he had through his childhood, that he was being forsaken, he was being neglected, he had so painful life, and there was no one who could listen to him. Even after getting married, he had the desire to have a male child, and that strong desire to have a male child could also not be fulfilled. So he is a person who always had that fight against his fortune, that why I'm so much unfortunate enough that I cannot even have a male child, why I cannot settle in my life. So this grudge, this resentment in the life, this offensivity in the life, and that starts creating that chronic inflammation, and that neutrophils cannot recover, and neutrophils are being taken up by the macrophages, and that chronic inflammation sets in because he cannot forgive, he cannot forget. So when we try to analyze this case, he is a person who has hold on the anger but lacks that courage to express that anger. He is a person who feels that I had that value, I had that hard work, I devoted my life so that my elder brother could go and complete his education, but no one has given me that worth. I feel that worthless. I feel being not appreciated. But when it comes to go and ask so many people that why I have suffered in my life, and people say that this is because of my karmas and this is because of my past experiences of my life. So therefore, I have to repay them. So I feel that I'm misfortunate. So I took the rubric in this case was definitely fear, misfortune of, or delusion, unfortunate it is. And there is also a rubric that unfortunate feeling of calcaria. And when you go into wound slow healing, therefore I have taken wound slow healing because it is definitely a psychosyphilitic case. So syphilis is that the wound is not getting healed. He has that sad feeling, that grudge, that I am misfortunate enough that I cannot have what I have in my life. And he is into the despair with varicose ulcer. So this was a psychosyphilitic case. So psychosyphilitic remedy needs to come up. The remedy which was coming up was calcarea over here. But he was not calcarea carp. He was not calcarea phos. He was not affectionate also. But he was an extrovert person. So the remedy from the calcarea group, who has got that tendency of going into deep ulcers and slow healing of wound and recurrent tendency of wound healing, the remedy which was given was calcarea sulph, 200. And to this case, till now, only 3 doses have gone. I needed to repeat because the healing process required that repetition. So repetition was done almost daily for 3 days. But then no other repetition. I just advised him at home, you need to submerge your leg, your feet into warm water and just allow this granulation tissue to come up. Just scrub the wound thoda sa because it was almost painless. So he felt that after the first prescription, he was so anxious. He came to me 5th day because he was not expecting such things to happen. So he said, ki, I just came to you because I'm not able to understand, ki, can this be so fast? Because I've already done plastic surgery, I've already done surgery, and still the wound was not healing. So this was almost 2nd or 3rd day, the same week of the prescription. And he said, ki, Arey, I'm so happy ki without bandage I can be there. And since the oozing had stopped, he could keep it with little bit of care. I advise them to have wash with water and just apply nothing if it is not oozing. Even don't suppress that wound with applying something, like they can apply steroid based and everything, but we advise them not to go. And during the follow-up process, he said, ki, doctor, I forgot to tell ki this ulcer was not the only ulcer. Near the heel also I had some wound which was not healing, and doctor had said me this was the past surgery which I have done. But after medicine, this has started curing, and even the oozing is coming from here. But after few days, he said ki this oozing has also stopped. So I can feel the strength in my legs now. The pain which was unbearable in the nights have reduced, and I can have a free life. So this is the follow-up case, and recent photographs, the wound has totally it has just become a thin layer which has come up. So this was the wonder of Calcarea sulf. And Calcarea sulf, I never thought of. He will cure this case so fast, because whenever varicose veins comes, we think of amomilis remedies, like even vipera comes to your mind, even snakes come to your mind, ophidias come to our mind. But Calcarea sulf, because this case had recurrent ulcers and suppurative tendencies, this case has brought up, and as soon as I am telling you that this wound heals, see, the pigmentation has started reducing, the case has started coming to the cure. This is one photograph which he has shared, that his pigmentations have reduced. So we will definitely help the patient. So concluding the lecture today, if I want to conclude this whole lecture, I would like to share from the nuggets of Sir or from our masters ki why did I take the whole lecture starting from elastin. Sir has beautifully mentioned a case of elastin less through the sharing of carbo-veg. He had said that when a disease, there is suppression of acute inflammatory diseases like pneumonia, cough, cholera, dysentery, abortion, or intrauterine fetus, etc. And that disease shifts its gear from recovery from such a prolonged acute illness, and the genetic code has shifted from psychosis to hypopsychosis, that is elastin less, and there is less of elastin synthesis and slowness, sluggishness of the tendons, muscles, and the blood vessels. There is elastin less at the muscle level. So what you will see, that there is stasis, slowness, stasis at the level of respiratory system. You will have lot of desire for fanning, desire for air. They feel chilly, still they need more of oxygen. Because of that more of oxygen, they feel air hunger. When it comes to GIT, they have offensive breath, offensive eructations, flatulence, sluggishness of the bowels, constipation, offensiveness of the stools. They are very slow to pass out. And when it comes to blood vessels, they are having congestive cardiac failure. They go into CCF because of stasis at the level of heart. And if patient complains of hemorrhoids after jaundice, then definitely think of carbo-veg. So summarizing the whole lecture, you come to know that such thought processes, that how the disease has progressed when the acute inflammation sets in, and the aphorism number 74, when it talks about how the acute inflammation has shifted to a chronic inflammation, and when the induration, dilatation or constriction sets in. So this is the beautiful sharing, because I could connect the whole lecture through this one sharing. And one more thing very important is if you rubrics when you think of varicose veins. Yes, these people, as a summarizing the emotional pathology with the cases which we have seen, they are mild, timid, cowards. They have lack of confidence, delusion insulted, delusion of not being appreciated. They are sluggish with memory weak. None of the cases which we saw was with great intellect. Neglected, they have feelings because they are not being valued in their life. They have forsaken feeling. They feel that their life is stuck, so they have obstructed feeling. Like in Carboveg also, they have that oppression over the chest. So they feel that heaviness. The stasis over the chest makes them feel that the chest is getting oppressed, heaviness. The anger is suppressed, there is vexation, irresolution, and indecisiveness. They are being dominated by others because they are too timid, discontented, and dissatisfied. They feel they are not being appreciated in life. They hold on the grudges and they cannot forgive. So they have hatred for those people who have offended them, and they cannot come over those offenses, and therefore they hold on to as an hatred. They have delusion being neglected, delusion of being crime committed, misfortune, unfortunate feeling which goes deep down to the genetic code, making them go into the despair of life, the weak willness, they never allowed to go ahead in the life, helplessness, sadness, and they are definitely people who don't like to be criticized, and therefore you have to be very cautious while you are handling them. You should never ever criticize them directly. You can give them with bread, with a buttery and flattery tongue, and you can tell them what you expect. So I told you the cases which I have shared, I have really tried to help them, but they are like very passive. They are very slow to respond. Sometimes they respond and sometimes they are like, "Yare, theek hai na, you give the medicine, doctor. We are very lazy. कौन walk पे जाएगा? मेरा जो walk है, I don't want like you give me advice. Garden, I go from my home, I go to my couch and I just enjoy that mobile. So this is the routine. I have so many cases of varicose veins. I have so many cases where I've observed that these people are really very difficult to convince them to start some healthy lifestyle, because they are indifferent to themselves also, and they are just people who don't want to take risk in their life, so that have that fear. Even they have fear of getting injured because they know that veins can burst anytime. So I have to be cautious. So they are the people who are very cautious also. They don't have that confidence that I can walk down so many steps. So they are the people who will not take those efforts also to walk those miles ahead. So you will find these cases who are so sluggish mentally also, intellectually also, and emotionally also. So this is the beauty of varicose ulcers and varicose veins, which I have tried to share with you people. You people have enjoyed the whole lecture, and everything was self-explanatory. I would only like to request you all is never ever miss the thread of pathology, because body will never lie. Body is a machine who would try to tell you why only in this person veins are affected, why not arteries. Why only this person suffer with all the cases. You will see that they have hernias, they have hydrocele, they had been operated so many times, still the body is failing to respond. The body is slow to respond. So just go and read which tissue is being affected in each and every case, and what that tissue functions in the body. If it is a vein, so how the venous system works. So we started our session from that, how veins are different from the arteries, and why these individuals who are suffering with the venous disorders are more passive, because veins are more passive blood vessels of the body, and they have to work against the gravitational force. So this is what exactly is in the mind also. They have to work against the resistance what they have been brought up. So I have tried to correlate through different pathologies, the miasmatic correlation, and how the miasms will differ with the remedies also, and how the selection according to miasm will give you a right remedy selection, and a right, you should know ki what is happening in this case. If it is a psychotic difference, which was there in the case of psychosyphilis, when the healing has started, there was psychotic pathology, lot of fibrin which came up, therefore the bubbles had come up, and when it was pure syphilis. So first need, when you are seeing pure syphilis or psychosyphilis where syphilis was prominent, there the healing process, if you have noticed the ulcers which was trying to heal, there was shrinking. The ulcer had started healing from the deep within the layer. The suppuration process, the slough which was forming, the thick borders which was there, which was because of the psychosis also, which has started getting surfaced up, and the wound has started healing not only from within but also from the periphery. So the ulcers, when you are healing these ulcers, they need to shrink from the borders also. But in the second case, when it was more of psychosis, there was lot of fibrin tissue which has come up, because we could see the ulcers were more puckered to the bottom. They were not like the visible ulcers on the surface. So this is the variation of Hering's law also, which we need to see. And see, in the third case we saw, when the above ulcer had started healing, the lower wound, which was suppressed way back, had also reappeared and again started closing itself. So this is beauty of homeopathy. So Hamamelis is also one of the beautiful remedy which can work like a plastic surgeon. Calcarea sulph can abort the process of recurrent suppuration. Such remedies need to be taken up into consideration, and please give importance to the pathology and the miasmatic understanding, so that in a nugget you can cure the case and bring up a beautiful cure process. This is the power of homeopathy, and thanks to our Guru who have given us this limelight and who have made the journey and the path so easy and so meticulous and so mathematical that things are really very obvious. Only thing is we need to have that perception and that vision to see. Thank you to all. We will be posting this lecture to our YouTube channel. So please feel free to share it, and please comment to the section whatever you feel like with the session, so that we can spread this right knowledge to everyone. So let us take the torch ahead and spread right homeopathy. Thank you.